there's something in between, which is a single fraction, SFRT, of radiation therapy of 8 gray. So instead of 2 gray, it's 8 gray. So it's more. Where did this idea come from? All right, in Europe in the 1990s, they were using single fraction 8 gray radiation to treat all kinds of cancers that spread to bones. And what happens when a cancer goes to a bone? It causes pain, and it tends to break the bone at that site because it weakens it. So they were giving palliative radiation and found it worked fabulously, just one zap of 8 gray. And we also knew that that would kill cancer in general, and Merkel's relatively radiation sensitive. So we started adapting this in the palliative setting. As you can see at the bottom there, we treated 87 tumors across 26 patients. 94% of them responded. Could we, should we? Then we expanded that and reported at the ISID meeting in 2023 with 40 cases with no recurrence. And now we have just submitted this study which I'll show you the data from now, where we have 43 patients in that single fraction radiation therapy arm, and compare that to patients who were just observed after surgery or those who got conventional postoperative radiation therapy, 156, over 100 in both of those other arms. So how do these compare? So the numbers were single fraction in the 43 patients, it's a smaller number, had 100% control. The conventional had 98%. Those are definitely not statistically different, but excellent control for both. An observation So the takeaways on radiation and local management here is the single fraction approach is well tolerated. It is convenient. We believe that it's effective, but this is largely a single institution that's reported as well. Michigan has now reported. There's other institutions that are starting to do this, but many radiation oncologists just look at us like we're coming from a different planet, and this is just craziness. So we're still pushing an uphill battle here.